Hi all, this is Mrs. Sperlaza, and this is a podcast to go over immunology, and this will include the chapters that are listed on this slide. So the immune system is like our body's Department of Defense. This is where our cells will protect us against objects that are foreign or substances that are foreign to our body, and as this slide points out, there are also different kinds of immune disorders, some of which we'll talk about and some of which we won't. The parts of the immune system include the following listed on the slide, and you can see there's a similarity with the hematologic system because it's about the cells. I want to particularly point out the thymus that figures into the immune system because the T cells end up migrating from the bone marrow to the thymus, where they mature and where they're launched when they're needed. This is the layout of the aspect of hematopoiesis that has to do with both the B cells and the T cells. If you remember, there is the lymphoid pathway as well as the myeloid pathway, and this shows you the lymphoid pathway. And of course you'll remember that the stem cells is where it all begins. The stem cells differentiate into these two pathways and then further differentiate. So what I'm showing you here is the pathway that ends up with both the T cells and the B cells. So there's different kinds of immunity. There is natural immunity, and this is basically a non-specific kind of those features of our body and cells that protect us in a non-specific way. Include such things as skin, chemical barriers that are inside of our body, gastric secretions, enzymes and tears, etc. It's also the includes the inflammatory response and the white blood cells that can engulf foreign substances, phagocytosis. There's also acquired immunity. This is kind of where cells can have a memory. If you are exposed either through disease or through a vaccine to a specific antigen, then the body develops antibodies that will fight that antigen in the future. And there's both active and passive. The passive immunity is that immunity that is passed on to a baby from a mother, after birth, and it's temporary, but it provides the baby with some protection at birth. So there's different levels of response. I've sort of alluded to this, but the nonspecific is that phagocytosis, which is where the white blood cells will just kind of engulf and eat up the foreign materials. Something enters the body and phagocytosis happens, and it's very nonspecific. The more specific types of immune response are both humoral, which involves the B lymphocytes, and this is the antibody response, and then there is the cellular immune response, which involves the T lymphocytes. And you can remember T lymphocytes, T for thymus. So the B cells produce antibodies, otherwise known as immunoglobulins, and the T cells, there's different kinds of T cells. There's helper T cells, cytotoxic T cells. These are the killer cells that I've mentioned before. There are those memory cells, and there are the suppressor T cells. And all of these cells work in different ways to help protect our body, basically. So sometimes it can be confusing, the difference between an antigen and an antibody. This is something you need to know. Antigens, they're the foreigners, they are the invaders, and it is a part of the foreign organism that stimulates the production of antibodies in our bodies. The antibodies are the protectors. They're the proteins in us that defend against the invaders. And so down here is kind of a little depiction of what that looks like. You know, the antibodies have this kind of a shape, and the antigens have this kind of a shape. And so the antibodies will fit on the antigens and engulf them. So here are some characteristics of antibodies. Agglutination, that's the facilitating phagocytosis, which is that capacity to engulf the antigens. Let me see if I can say this right. Opsonization, which is coating the antigens, which increases their susceptibility to the antibodies. The release of vasoactive substances like histamines. We'll learn more about that later. And all of these act in concert with other components of the immune system. The types of antibodies that are in our body are listed here, and IgG are the most common. About 75% of the total are IgG. There's other non-T and non-B lymphocytes involved in the immune response, null cells and natural killer cells. Variables that affect the immune system, these are pretty self-explanatory, but you need to consider these factors. All of these factors can affect the ability of the immune system to function properly. Here are some of the common tests that are used to evaluate the immune function. Some of them you're very familiar with, some of them you may not be familiar with. So let's talk a little bit about inflammation. This is it shows you sort of the steps in an inflammatory response. So I want you to be generally familiar with this, and what I want you to do is also, there's a link here, so if you can go to that link, and after reviewing this picture, go to this link and see if you can identify in the little video, YouTube video, the different parts of the inflammatory response. So, some clinical symptoms of inflammation. These should be very familiar to you. You've probably all experienced them at some point in your life. Redness, pain, swelling, loss of function. And then those are the local responses, and then the systemic responses, I'm sure, are familiar to you. All right, so managing immunodeficiencies, which is chapter 36. Okay, from this slide, I just want you to understand that there are some immunodeficiencies that are, primary immunodeficiencies that are, such as B cell deficiencies or D cells deficiencies that are genetic. But what is more common is the secondary immunodeficiencies, and this is, of course, the result of result of underlying disease or treatments such as chemotherapy, radiation. We know that people who are getting treatments such as these are very immunosuppressed, and so this is a more common type of immunodeficiency. So, considerations for nurses. If somebody is immunosuppressed, they are certainly at risk for infection. And the signs of infection can be very subtle, because since their immune system is suppressed, the responses to the issues that are causing the potential infection are more blunted. So the you need to be very observant and report any changes that occur. This is also important to monitor lab values. That's very important, as is protective isolation, and of course the very, very basic rule and safety precaution of hand hygiene. It's just absolutely critical in this population. Also, good education about oral hygiene, nutrition, lifestyle, stress management. All of those things can further impact the immune system. So in Chapter 37, we're going to talk about HIV/AIDS. And this HIV/AIDS is an infection that basically reduces the T cells, otherwise known as CD4. It cannot be cured, and it is a retrovirus, which means it has to do with the RDA rather than the DNA, RNA instead of the DNA. AIDS is the late stage of HIV. Not everybody progresses to this point, and at this point, with all of the advances in treatments for HIV, it is really like some of the cancers in that it is more of a chronic illness that needs to be managed rather than a death sentence, basically. As you probably already know, it's transmitted via body fluids, not through casual contact. At this point, there is almost no risk of transmission through transfusions, and the other method of transmission is from mother to baby, usually through exposure through delivery. There are some special considerations in the geriatric population. Often this population has unprotected sex. They are typically postmenopausal, so they don't have the issues of pregnancy, and it's not uncommon to have unprotected sex. Also, in this population of people, they may have had blood transfusions at an earlier time when the risk of contracting HIV/AIDS or HIV was higher. The immune system is also just normally depressed or decreases with aging, and also this population may not believe that they have any risk, so it is something to consider. Remember, we also talked previously in the hematologic section about the risk of this population of people being infected with hepatitis and other bloodborne illnesses, again from previous exposure. Okay, so in this, just a little bit about pathophysiology. What I have put in this slide is a kind of a generic life cycle of a virus, which is the same for HIV. And again, HIV is a retrovirus, and so it carries its genetic material in RNA, not DNA. And there is a picture in your book, page 1003, of the cell cycle, and it's quite complex. So you don't need to know it in detail, but just have a general idea of how it works. So there are different stages of HIV/AIDS. In the primary, after a person has been infected, the infection may, initially the person may test negative for, I can't remember exactly how long that may be, like maybe 3 weeks. It says in your book, so don't quote me on that, but you can look it up, where they may have generalized flu-like symptoms, but they are, this is the acute phase. And at this point, their T cells or CD4 count is greater than 500. And as you can see, I put what the normal CD4 count is. In the chronic or latent phase, they may be asymptomatic, and this is where their counts drop to between 200 and 499. In the late stage, the active stage, AIDS stage, their CD4 count is less than 200. So remember the different levels of prevention. If you relate this same idea to HIV/AIDS, primary prevention would include education about such things as proper condom use, information about HIV/AIDS. In secondary prevention, this is where you're screening or testing the for the HIV virus, and the